Hi, I'm Anthony Simons and I will be presenting on the respiratory disease emphysema. Emphysema is one half of a condition called COPD. COPD stands for Chronic Obstructive Pulmonary Disease. It is a disease that makes it hard for people to breathe. It is usually a mix of emphysema and chronic bronchitis. Bronchitis inflames the passageways that carry air to the lungs, while emphysema is when the air sacs are damaged. More specifically, the inner walls of the alveoli, air sacs, are damaged and rupture over time. This creates a larger space but less surface area, which in turn reduces the oxygen that can enter the bloodstream. As I stated earlier, shortness of breath is a staple indicator of emphysema. It is most prevalent in older individuals and those that smoke. The main symptom is shortness of breath. People with emphysema will have trouble, especially with climbing stairs. Coughing and wheezing are also present. If lips or fingernails turn a blue or gray color, it means the disease has taken a bad turn and requires immediate attention. Many of those with emphysema will not be as mentally alert. Pursed lip breathing is a unique symptom to emphysema. The individual won't exhale completely to try and empty trapped air in the lungs. They purse their lips to only leave a small opening. This causes air to be blocked when exhaled, which increases the pressure in collapsed airways. They are then opened and trapped air escapes. Some people also develop a barrel chest. This is caused by the air being trapped in obstructed airways. The leading cause of emphysema is smoking. It causes damage to lung tissue and decreases blood flow. The smoky air causes cilia function to decrease, which usually helps clear mucus. Mucus production is also increased, resulting in bad airflow. General air pollution can contribute to emphysema in similar ways as smoking tobacco does. One specific cause of emphysema is alpha-1 antitrypsin deficiency. When there isn't enough of this substance produced, it can't fight off trypsin. Trypsin is a digestive enzyme that, when not removed quickly enough, can start to destroy lung tissue. In general, being male or just of an older age increases the chance of getting emphysema. There are also some complications that can develop from emphysema. In those that have the disease to a more serious degree, pneumothorax is a possibility. Although uncommon, sometimes extremely damaged lungs can just collapse. Heart problems can occur if the pressure is increased in the arteries due to the damage in the lungs. Some people may also develop bullae. This is a large hole in the lung, sometimes up to half the size of the lung. This also increases the chance of a collapsed lung. There are a multitude of treatments for emphysema. Two options are bronchodilators and steroids, which can both be inhaled. Bronchodilators such as albuterol will help by relaxing and opening air passageways. Steroids decrease inflammation, but also come with side effects over time. Vaccines and antibiotics should be taken as needed to help fight off infections that occur more easily because of emphysema. If patients find it harder to breathe, they may be given oxygen, which can be delivered in different ways in different settings. Those that have emphysema caused by alpha-1 antitrypsin deficiency can be given AAT to help decrease damage done to the lungs. This is called protein therapy. Lastly, surgery can be used for some patients. A whole transplant can be done if a good match is found and the disease is serious enough in the patient. Lung volume reduction surgery is a more common procedure. Surgeons will go in and remove small pieces of lung from the patient. This allows the remaining lung to expand better and help improve their breathing.